Hi everyone. Yesterday I was sitting next to a lady at a children's party and she happened to make the comment, well, at least chemotherapy cures cancer. Well, that's an interesting statement. Does chemotherapy cure cancer? Does surgery cure cancer even? I mean, one needs to then have a look at why do people get cancer? Well, clearly it's not straightforward. I mean, this so-called war against cancer hasn't done much good for cancer. I mean, cancer is still increasing, and there's starting to become evidence that it's going to move from the number 2 cause of death to the number 1 cause of death. Over the last year or two, incidence of cancer has been skyrocketing. So has the war against cancer succeeded in any kind of way? And is surgery and chemotherapy the answer? Well, it depends again how one tries to understand cancer. Is cancer just a local problem, or is it a systemic problem? Is it a problem of the body that's manifesting as a cancer, or is it just a local problem? Well, the question of, one could say that things like, let's say, basal cell cancer of the skin, that's a local problem. Too much sunshine on the skin has caused the basal cell cancer. But then we have to ask the next question, why in that spot? Why not in that spot? Why there? So that means that there has to be some kind of susceptibility in that spot where the basal cell cancer developed. So again, it's not straightforward at all, that it's just the sun is a precipitating factor in one sense, and there has to be a susceptibility. So it's the same with, let's say, hay fever. A lot of people say, oh yeah, I get hay fever, dust causes my hay fever, or pollens cause my hay fever. But is that true? I mean, if it was in fact dust, then how come everybody doesn't have hay fever who's in contact with the dust? So it's not straightforward. You see, there has to be a susceptibility to the dust. Otherwise, dust is not going to cause a problem. So it's only in those people where there's a susceptibility will dust cause attack of hay fever. So what causes this susceptibility? Well, again, we run into a whole story, because that susceptibility can be due to all kinds of things. It could be due to the food we eat, the stress we have, toxins in our environment, our genetic factors. There are a whole range of underlying causes, not one cause, no condition has one cause, which leads to a susceptibility, which allows dust or pollen to precipitate an attack. So the dust or pollen is not the cause, in one sense, of the hay fever. It's a precipitating factor. So cancer's a little bit like that as well. It's not just local, or just some precipitating factor like sunlight. There has to be an underlying susceptibility. Something is happening. So the example that I often use is the motor car which breaks down. Can't move. Turn the key, nothing happens. Now something might be broken in that motor car, and one needs to have that part that's broken fixed. Then the motor car can move again. But have you done a full job? Have you done a tune-up on the motor car? And have you spoken to the driver about his driving technique and what petrol he's using and oil, etc.? So where it breaks down is what I call an endpoint. That's the endpoint of car that is dysfunctional, a driver that's not driving well. Eventually the part breaks down. Fix the part that's broken. Do a tune-up on the car. Speak to the driver. So it's the same with cancer. Cancer is an endpoint, what I call an endpoint diagnosis. It's the result of a lot of things happening inside that body. And the endpoint is the cancer. Remove the cancer. Don't just send the patient home and say, okay, come back in 6 months' time. You haven't done the tune-up yet. Have you checked the lifestyle, the food choices the person is making, the exercise and the stress factor, all these factors, toxins in the environment. All those are still sitting there. Those are the real underlying factors which have slowly caused problems inside the body which have led to the cancer. So the cancer is an endpoint. The treatment is much bigger than just surgery. Chemotherapy is a little bit like chemical surgery. you're trying to destroy the cancer. And it's, yeah, you can shrink the cancer, but shrinking, we know, doesn't make a big deal. It can maybe extend life, but chemotherapy is incredibly toxic. And if toxins are the underlying cause, or part of the underlying cause of ill health, then we have to take some care. I came across this in an article this morning. It says here, there is little doubt that the treatment of cancer, especially radiation therapy and chemotherapy, greatly accelerate aging. Not surprising. So, yeah, you can have chemotherapy and it might in some way control the cancer, but it's seriously toxic and can have problems later in the person's life. A recent overview of survivors of childhood cancer showed that these individuals were at greatly increased risk for substantial comorbidity and premature death. So yeah, I mean, I think for me it's saying, hang on, guys, maybe there's a place for chemotherapy, maybe there's a place for radiation. I don't want to deny any of that because I haven't done the research work, but I can see from the research that it can cause a problem. So when you treat a cancer patient and you use surgery and chemotherapy and radiation, please, when you send the patient home, send them to somebody who knows how to support health, how to raise their functionality, because the chemotherapy is a toxin, does seriously damage to the body. Well, that's okay, but let's work at raising the efficacy of the body's functionality. We know patients are deficient in vitamin D and magnesium and selenium and iodine and a whole range of remedies. Don't send them home just like that. Chemotherapy also causes a lot of nutritional deficiencies. Let's now, when your patient goes home, optimize health to the best of our ability. I think as medical doctors, we need to do that. It's no good just treating an endpoint and then sending the patient home. Have a good day.